Knock, knock. Hi, my name's Layton. I'll be your nurse today.
Hello.
I haven't sanitized my hands, got my gloves on. Okay, so we're going to be doing a musculoskeletal nurse interview and physical assessment. Have you had any recent weight gain?
No.
Any difficulty chewing?
No.
Any joint, muscle, or bone throbbing?
No.
Okay. And like any past problems or injuries to joints, muscles, or bones?
No.
Any past treatment or surgeries?
Can't say I have.
Do you have your tetanus and polio immunizations?
Yes.
Okay. Do you have diabetes, lupus, or sickle cell anemia?
Nope.
Do you have a family history of rheumatoid arthritis, gout, osteoporosis, psoriasis, or infectious tuberculosis?
No.
Okay. Do you do any activities such as exercise to promote musculoskeletal health?
Yes.
Okay. Do you use any assistive devices to promote mobility?
Sorry, what?
Do you use any like canes or walkers or
No.
anything? No? Right. Do you spend a lot of time in the sunlight?
Yeah.
Okay. Alright. Do you have any difficulty with activities of daily living?
Nope.
Do you have any stress in your life?
Nope.
Okay. Alright. Or does your muscular ability put any stress on your life?
No.
Does it interfere with anything? Okay. We're going to move on to the physical assessment now. Alright. So I'm going to have the client, I would normally observe their gait when they walked into the room, but since we're doing this video, I'm just going to have the client stand up for me. Just to have you stand over there and then face me, take a few steps so I can observe your gait. Okay, just take a few steps this way, just normally how you'd walk. Okay, turn around, take a few steps that way. Okay, thank you. All right, you can take a seat. So the client's gait was normal. And like I said, we would normally just observe this when they walk in the room. So they just walk how they normally do. Their gait's evenly distributed weight. Client is able to stand on heels and toes. Toes point straight ahead, equal on both sides. Posture is erect, movements coordinated and rhythmic. Arms swing in opposition and stride length is appropriate. Okay. All right. So I'm going to go ahead and inspect the client's temporomandibular joint. So I'm just going to have you. All right. I want to put my hands on their joint. I want to have them open their mouth. If they could see, we're just going to scoot a little closer. Okay. So go ahead and go like this and open. Okay. Now move your jaw side to side and forward and backwards. Okay, thank you. So the temporomandibular joint, all the findings were normal. No snapping or clicking was felt or heard. The mouth opens 1 to 2 inches. The client's mouth opens and closes smoothly. The jaw moves laterally 1 to 2 centimeters. The jaw protrudes and retracts easily, and the jaw has a full range of motion. All right. Now we're going to do the sternoclavicular joint. Okay. All right. All right. So we're going to move on and inspect and palpate the cervical, thoracic, and lumbar spine for pain and tenderness. So I'm going to go ahead and observe the curves of the client's spine from the side and then from behind. Okay, so I'm observing from the side, and then I would also go behind and observe the client's spine. And I would also, I'll have you stand up too. Okay, I'll observe from the side, then I will go observe from behind. Okay, so I'm going to also palpate the spinous process and the paravertebral muscles on both sides of for tenderness and pain. Let me know if you feel it. It's okay. Normally, yes, we would do this on the client's skin, but since it's a video, so I'm going to palpate this. Do you have any tenderness or pain?
No.
We're also going to do the muscles outside. No tenderness or pain?
Nope.
Okay, thank you. So the cervical and lumbar spine are concave and the thoracic spine is convex. You can see. The spine is straight and when observed from behind, it's non-tender spinous processes. They're also well-developed, firm, smooth, and non-tender paravertebral muscles, and there's no muscle spasm. So all normal findings. So we're gonna test range of motion of the cervical spine. So I'm gonna ask the client to touch their chin to their chest. So go ahead and touch your chin to your chest. Okay, thank you. Now look up at the ceiling. Okay, thank you. Now I'm gonna have you turn your head to the right and to the left. Okay, the other side, thank you. So flexion of the cervical spine is 45 degrees, extension of the cervical spine is 45 degrees, and about 70 degrees of rotation is normal, so all his findings were normal. Now we're gonna test range of motion of thoracic and lumbar spine, so I'm gonna ask the client to stand up. Go ahead and turn to the side, and then bend forward and touch your toes. Okay, thank you. Now, okay, do it one more time so I can observe. Okay, thank you. Now I'm gonna ask you to bend sideways. So bend like this to each side, or you could face the camera. Yeah, so do your lateral bending just like this to each side. Okay, thank you. All right, and now I'm gonna ask you to twist the shoulders one way and then the other, so like this. Okay, thank you. So you can take a seat. So the lumbar, the flexion of 75 to 90 degrees, smooth movement. Lumbar concavity flattens out and the spinal processes are in alignment. Lateral bending of the lumbar and thoracic spine should be 35 degrees, a hyperextension of 30 degrees, a rotation of 30 degrees. So all his findings were normal. So now I'm gonna inspect and palpate shoulders for symmetry, color, swelling, and masses. Okay, so I'm gonna go ahead and palpate your shoulders. Thank you. All right. So the shoulders are symmetrically round, no redness, swelling, or deformity or heat. Muscles are fully developed, clavicles and scapula. So we're gonna go ahead and also palpate his clavicles. And then I'm gonna have you, could you stand up for me and turn to the side? We would normally do this sitting down. I'm also gonna palpate his scapula and his shoulder blades. Okay, thank you. You can take a seat now. So the clavicles and scapula are even and symmetric, and the client says you feel any pain or tenderness?
No.
All right, they also report no pain or tenderness. So now we're gonna test range of motion on the shoulders. I'm gonna have the client start. Okay, go ahead and stand up for me, please. And start with your arms straight down at your sides. I'm gonna have you move your arms forward. This, both arms, please. Then backwards, behind you. Okay. And then I'm gonna have you bring your hands overhead with elbows straight, like this. Keep your elbows straight. Okay, and then move hands in front of the body past the midline. Thank you. And then also go like this and this with your elbows straight, and then go down. Okay, thank you. Oh, also do, well, we just did that. So we put the client's arms up, and then we went behind. And then we'll go up, arms straight and forward. Okay, thank you. So, hyperextension should be 50 degrees, abduction 50 degrees, or adduction 50 degrees, abduction 180 degrees. External, internal rotation should be 90 degrees. Can you also go ahead and shrug your shoulders against resistance? Okay, thank you. So the client's also able to shrug his shoulders against resistance. Okay, go ahead and go like this as well. Okay, and then like this. Okay, thank you. That was also to help with the external, internal rotation. All right, so we're gonna inspect the elbows and palpate them. So I'm just gonna palpate the elbows and inspect them. Go ahead and do a slight bend. Okay, so the elbows are symmetric without deformities, redness, or swelling. So range of motion of the elbows. Flex the elbow. Okay, go ahead and go like this. Okay, now go ahead and go like this. Do you keep your arms?
No.
Or yes, you could rest. You would normally rest it.
So, like, there.
So go ahead and hold your hand like this.
Yep.
Be able to turn it like this and like this. Okay, perfect. And then, okay. Okay. So the range of motion elbows, flexion 160 degrees, extension 180 degrees, pronation 90 degrees, and supination 90 degrees. So all the findings are normal. So now we're gonna go ahead and look at the wrist and inspect them and palpate them. Let me take a look at your wrist. Okay, let me see it this way, and let me see this wrist. Okay, let me see it this way. Okay, thank you. All right, so the wrists are symmetric without redness or swelling. They are non-tender and free of nodules. Test range of motion of the wrist. I'm gonna have the client bend the wrist down and then back. Push them down and flex them upwards. Okay. Now we're gonna have okay. Okay, go ahead and move the wrist inward and outward. So maybe like this. Okay, thank you. So the flexion was 90 degrees, hyperextension 70 degrees, the ulnar deviation 55 degrees, radial deviation 20 degrees. Everything is normal. We're gonna test for carpal tunnel syndrome. So I'm gonna have the patient do the Fallon test, and then they would hold it for normally 60 seconds. But for the video, we're not gonna hold it that long, so go ahead and hold your hands like this. Do you feel any pain when you do that? Okay. Now we're gonna go ahead and do the Tinel test. So I'm gonna percuss slightly over the median nerve located on the inner aspect of the wrist. Okay, let me go ahead and just percuss. Any pain or tenderness?
No.
Okay. So those are normal findings. There was no tingling, numbness, burning, or pain for both tests. So he does not have signs of carpal tunnel syndrome. All right, so I'm gonna inspect the fingers and palpate them. So let me just take a look at your fingers. I'm going to palpate them. Let me see this hand. Okay, thank you. So the hands and fingers are symmetric, non-tender, without nodules. Fingers lie in a straight line, no swelling or deformities. Rounded protuberance noted next to the thumb. Over the prominence, smaller protuberance seen adjacent to the small finger. We're going to test range of motion of the hands and fingers. So go ahead and spread your fingers. Thank you. Okay. Go ahead and make a fist. Thank you. Go ahead and bend your fingers down. Now go ahead and bend the fingers up. We'll try and keep your hands straight. Flex them up. Okay. Move the thumb away from your fingers. And then touch the thumb of your finger to the base of the small finger. Okay, touch it to your pinky. Okay, thank you. So all the client's findings were normal. Abduction 20 degrees, full adduction is fingers touching. Flexion 90 degrees, hyperextension 30 degrees. The thumb should easily move away from the other fingers, and 50 degrees of thumb flexion is normal. All right, we're gonna go ahead. I won't be palpating or inspecting the patient's hips on camera, just for the purpose of the video, but I would inspect and palpate the patient's hips, and the buttocks should be equally sized. Iliac crests are symmetric in height. Hips are stable, non-tender, without crepitus. Now we're going to test the range of motion of the hips. So the client will be laying down. Go ahead and lay down for me. Go ahead and just raise your leg straight up. Other leg. Thank you. Okay, now go ahead and flex it like this, up. Okay, other leg. Thank you. Okay, go ahead and push one leg bent upwards. Can you flex it inwards and out? Go in and then out to the other leg. As much as you can, yes, with the couch, okay. Then we would also go ahead and just try to spread your legs out. Okay, thank you. That was good. And then go ahead and lay on your stomach. Okay, we are almost done with our assessment here. Go ahead and try to lift one leg up at a time. Try to keep your knees straight. Okay, do your other leg. Perfect. You can go ahead and go to a more comfortable position and sit. So the range of motion of the hips is normal. Flexion is 90 degrees with knee straight. Flexion 120 degrees with the knee bent, other leg straight. 45 to 50 degrees abduction, 20 to 30 degrees adduction, 40 degrees internal hip rotation, 45 degrees external hip rotation, 15 degrees hip hyperextension. Okay, so I'm going to inspect and palpate the knees. Okay, We are almost done here. Okay, inspect and palpate. So the knees are symmetric, hollow present on both sides of the patella, no swelling deformities, lower leg is in alignment with the upper leg, non-tender and cool, muscles firm and no nodules. All right, so we're gonna test the range of the motion of the knees. So bend each, go ahead and stand up for me. So bend each knee upward toward the buttocks of the back, like this. Do the other leg, thank you. Okay, straighten the knees, so you're able to straighten your knees, correct? Okay, and the patient is able to walk normally. So that is normal findings. Flexion 120 to 30 degrees, extension 0 degrees, or hyperextension be 15. The client does not have hyperextension, so it's 0. All right, so we're not going to do the McMurray test because you only do if the client complains of giving interlocking. No pain or clicking should be noted during this test. Now I'm going to inspect the ankles and feet. I will not have the patient expose their ankles and feet on video, but I would be inspecting them, and they wouldn't have shoes on, of course. I would inspect and palpate them accordingly. And the toes usually point forward and lie flat, however they may point in and out. Toes and feet are in alignment with the lower leg, smooth, rounded, medial, malleolar prominences with prominent heels and metatarsophalangeal joints. Skin is smooth and free of corns and calluses, longitudinal arch. Most of the weight bearing is on the foot midline. No pain, heat, swelling, or nodules noted. So range of motion, go ahead and go like this. If you could show, so yes, and then point your foot and then flex it upwards. Thank you. Okay. So go ahead and hold your leg up for the camera so they can see. I will support it. Go ahead and, are you able to turn like so? Okay, thank you. And then, oh, okay. Okay, so perfect. So all the findings are normal. So the dorsiflexion 20 degrees and 45 degrees for plantar flexion of ankle and foot. Eversion 20 degrees, inversion 30, abduction 10, adduction 20, flexion 40, and extension 40 degrees of the toes. So that concludes our physical musculoskeletal assessment. And so I would escort the patient out, take my gloves off, and wash my hands. Thank you.